Improving access to antiretroviral treatment, reaching priority groups, and consolidating a strategy for ending AIDS by 2030 are all high on the agenda at this year's 21st International AIDS Conference in Durban. Under the theme Access, Equity, Rights Now, the conference is on its second day, where global experts are discussing the importance of a greater response to dealing with HIV. So for more now from the conference, we're joined once again by reporter Ayanda Mhlongo. And Ayanda, this is an opportunity or a time for policymakers to build on some of the big gains of the past decade. And one of these gains has been improving access to antiretroviral treatment.
Absolutely, Natasha, a very good afternoon to you. Once again, access to treatment, that is the call from civil society who is here at the conference. Of course, policymakers are also making their commitments to ensure that more and more people that are infected or affected by HIV are able to get onto the treatment programs. In South Africa, great progress has been made. We count now 3.4 million people are now receiving ARVs, and a large number, over 1 million, are here in the province of KwaZulu-Natal. And that has largely been attributed to a nurse-initiated program which began in 2010, and it's seen over 1,700 nurses being trained. Now, to hear more about this program, I'm joined by the MEC for Health in KwaZulu-Natal, Dr. Sibongiseni Dhlomo. MEC, very good afternoon to you, and thank you very much for joining us.
Good afternoon, Ayanda, and good afternoon to all your viewers.
MEC, take us through very briefly NIMAT, the program. Tell us about it.
This is a very noble vision that actually came to those leaders who came before us. The word NIMAT stands for Nurse-Initiated Management of ARTs. So this is a situation where patients do not have to see a doctor to be started or to get medication, ARVs. They can actually be seen, monitored, and be administered by a nurse. Now, we have now over 3,000 of those nurses in this province alone, scattered all over our over 400 clinics and hospitals, doing this job of making easy access for our patients to ARVs.
MEC, now that government has started the test and treat approach, which means a person, if they are tested positive, they need to now immediately be put on treatment. How are we going to meet the expected higher demands? I'm taking into consideration the rate of new infections.
Firstly, we are very excited about the decision and the announcement made by our minister about 3 months ago. You realize that the minister did not say the announcement starts the next day. So he says, let's go and plan and start in September. So it means, firstly, we are going to say these nurses who are already trained as NIMAT trained must then be able to mentor and train the others on this concept of train the trainer, so that some of them may be certificated some other day, but they would already have been trained by those who are in there. But number two, we want to say patients that are on treatment beyond 15 months are stable enough not to come to our facilities every month. Those are our patients that we are going to get them out of our hospitals, out of our clinics, send their medication to homes, either in a hall or in a church or in any area where they can access it easy. We have already started that in the province. We have over 104,000 patients who are now coming into our clinics once every 3 months. The rest of the other 2 months, they collect it at home. So we are going to enhance that, so that new entrants, those patients who actually are going to be started on this program of test and treat, can then access the clinics, and they find the clinics that do not have long queues, because anyway, patients have already been sent home and they are collecting medication closer to their homes.
And I know with that, MEC, we are also trying to address stigma, which remains quite a challenge for people living with HIV.
Absolutely, because when I receive my package at Mbumbulu and Ikopo in the community hall, it's going to be a package for MEC Dhlomo, and whether there's inside there medication for ARVs or for hypertension, diabetes or arthritis or any other illness, that's also going to take away the stigma. All that is going to happen, that patients now are going to access or receive medication sitting at home, waiting to be served there. There's a wonderful program which we call Central Chronic Medication Dispensing and Distribution, which we have rolled out in the province.
Before I let you go, MEC, tomorrow I know you'll be launching a book and documentary which has documented these very nurses that we have been speaking about that have been part of the NIMAT program.
We are extremely excited. I've spent over 60 hours in this province, spending about 5 hours in each district, listening to the nurses, making their testimonies, giving us their presentations, how they've actually made South Africans live longer. You could imagine this 1.1 million are breadwinners. People are now able to look after their families. But these nurses have had wonderful stories. We are now launching this book through the USAID, and I hope that we'll invite you there to listen. A nurse who's able to initiate medication in a polygamous relationship. All women, all wives of this one man starting treatment. So it's a wonderful program. We are launching it, it's not tomorrow, on Thursday at 7:30 in this ICC, where we are launching it and getting and UNAIDS to hand over this book to us, and we are going to give it to our premier. Extremely exciting. No other province has documented the work of the nurses. One of the things why we are doing it is to actually profile the nurses, the role of nurses, which is something that we have always overlooked. Nurses will always becoming subservient to the doctors. For this time, KwaZulu-Natal is saying thanks to our nurses, thanks to the NIMAT. That is why today we have 1.1 million South Africans in KwaZulu-Natal who are on treatment.
MEC, thank you very much for your time. MEC Dr. Sibongiseni Dhlomo telling us interesting things to look forward to. As he said, tomorrow they'll be launching that very, very interesting book which documents the work that has been done by nurses here in the province of KwaZulu-Natal. So we are able to now say that over 1 million people now have access to ARVs in the province. But I can tell you, Natasha, there is a lot that is happening. I'm sure you can see the delegates moving around up and down behind me. As I said, it's very busy. It's a lot of sessions underway, plenary discussions, but also there's a lot that is happening outside of the conference, all related to the topics and the debates that are continuing here. And just one interesting thing that we'll be looking out for tomorrow, we've been speaking about global ambassadors who are here. Yesterday we heard Charlize Theron. She arrived and has been part of this conference, but we now mentioned a new name, Elton John. He will be here. He'll be in Umlazi tomorrow, so a lot to look forward to. So we'll be continuing to give you all the latest news and developments coming out of the 21st International AIDS Conference. Natasha, it's back to you.